I want to be walked through the surgery
Excuse me.
again.
Can I see your ID? Oh, you must be the new doctor.
Yeah, I'm new.
You'll have to go to the Human Resources Department for a staff ID. To get there, make a left at the elevator, a right down the hall, and it's the first door on the left.
Yeah, I know where it's at, sir. I'm kind of an important person.
Oh,
No,
hello,
I don't want to talk to you.
Doctor. The first thing you have to do is to get your staff ID card in the Human Resources office.
Let's go to
Go
HR.
left at the elevator,
Yes, yes,
go
yes,
right
yes.
down the hall, and it's the first door on your left. Then you must come back here to sign in. I'll see you in a few minutes.
Oh, thank you. There we go.
Maintenance to the third floor, hall 4.
How are you doing? Please sign the logbook, and I'll issue you your ID card.
I am Doctor Papiopolis. Papiopolis. Oh,
Here you go.
oh, thank you. I'm a fellow. 1, 2, 2, 2.
Would you like me to print you a copy of your staff ID card? Please return to the receptionist's area, located near the visitor's entrance, and sign in. Have
Okay.
a good day, Doctor.
Let's go sign it.
Hello, Doctor. You can sign in on the computer.
Can I just hit 3? Yes, I can. 1, 2, 2, 2. Enter. Papiopolis.
You better get moving, Doctor. You have patients waiting for you on the second floor in the CCU.
It's Dr. Papiopolis to you. Thank you. Let's go look at our patients. What do we got here? Very sharp and located under the right breast area. I feel like a knife stabbing my chest. Trouble breathing because of the pain. Let's do a physical examination.
Ow!
He hurts.
Ow! Ow!
He hurts on the right side. Let's tap him on the back. Okay, what does this chart say? Normal, normal, normal. Patient experienced pain. Pain in the percussions. Let's go get lab work done. Lab work makes the dream work. Where's the lab work? What lab? There we go. So what do we got here? Normal enzymes. Blood work's coming back normal, I think. Is that normal blood work? I wrote that down somewhere. 90, 40, 24. Yeah. Your labs come back and they're all in range. Let's go get a X-ray. What was yours? Very sharp, located under the right breast. Let's go look at your X-rays. Oh, wait. What's your name? Who were we looking at? My mistake. John. John A. Let's look at your chest. Let's look at your echocardiogram. Turn around, please. X-rays. Normal. Do we need to do a catheter? Heart station. Uh-oh. There we go. Tell me what. Your stress test is coming back normal. Everything seems normal there. Hang on. I got my dog out. Trouble breathing. Oh, he didn't die. Excellent. Excellent. What? What happened?
You're making too many mistakes. Read your evaluation photo right now.
What did I do? Why is it unnecessary? Okay. Okay, dude. Enough with you. Diseases causing chest pain.
Sometimes emotion can cause unusual reactions such as chest pain. Chest pain from anxiety reaction occurs during excitement or when upset.
Okay.
Pain can be similar to heart attack and can have all the similar signs.
But his... Do I need to do an upper GI?
Angina is caused by narrowing of the coronary arteries that supplies the heart. The heart does not receive enough oxygen and part of the heart muscle is
Tightness and squeezing. everything else is normal? What would cause the pain when you do the percussion? Blockage of an artery. Treatment for angina. Esophagus.
Spasm of the esophagus usually occurs due to irritation by the acid from the stomach that flows back into the esophagus.
That's not it. Musculoskeletal pain.
Musculoskeletal pain or a sprain occurs when the patient injured himself or if there is an irritation of the muscle or the bone. Also aggravated by breathing and movement and touch.
Abnormal complaint pain. Oh, this just might be musculoskeletal pain. What's the treatment? Pause that. Pain medications such as aspirin as well as muscle relaxants. Okay, let me see if I can... Oh, so you just slept on it wrong, huh? Jesus. Diagnosis. Do that. Do treatments. Aspirin and muscle relaxants. Nope. Order the treatment above. Did I get this guy? Ah, I got one. I got a right one. Great. Great, great, great. This is still John A. Oh, there. Thanks. I did it. I did it.
Doctor, have you reviewed all the test results you ordered?
Not yet. Chill out. Chill out. Oh, let's go to the store. What's your name? Phil. Where's my bin? Let's see what's going on today, Phil. What's going on with you today? I woke up with severe pain in my chest. It hurt really bad. It still hurts right now. I threw up a couple of times. So, chest pain. Let's do your physical exam. You sound great. Is that little click supposed to be there? Well, what does it say? It's normal. Let's do some labs. One lab. I bet he has elevated enzymes. Elevated enzymes. Let's see. Nope. I believe, sir. Oh, what? I woke up with severe pain in my chest. It hurt really bad and still hurts right now. This almost sounds like some sort of indigestion or something. Let's go to the library.
Spasm of the esophagus usually occurs due to irritation by the acid from the stomach that flows back into the esophagus.
Okay. Okay. Okay.
This spasm of the esophagus is seen in hiatal hernia. The patient complains of indigestion or severe chest pain. The pain can also be associated with nausea or vomiting and cold sweats.
Ooh, that's pretty on there. Nausea, vomiting, cold sweats. Everything's coming back normal. EKG and chest x-rays. Wait. ECG. What is ECG? That's not the echocardiogram, is it? Oh crap. Echocardiogram normal. Then what is ECG then? So do an upper GI. So let's go do an upper GI. For Phil. That's a spasm right there, my friend. I know a spasm when I see one. I know a spasm when I see one. Oh, I didn't see what the treatment was for that. Zantac, right? Da, da, da.
spasm of
Treatment for. I missed it.
spasm of the
It doesn't pause sometimes. Is it still running? It's running. Show me the treatment, please. Okay. 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 I kind of saw that, but it just kind of like nopes out on you there. Let's see. We're gonna give you some treatment there, buddy. Come on, Phil. Open up the handbook. We're gonna give you. No, we need. Oh, diagnosis. Gonna diagnose you with. Oh, what? A spasm. Cha-ching. We're gonna give you. Gonna drain your fluids. Gonna change your oil, boy. Does that just close the book? Wish there was a way to like go back a page. You can only go forward. That's kinda. You know what? Oh. Treatment. Got it. I got another one. I did 2 patients. I'm a real doctor.
Just a little friendly advice. If you want to remain a doctor, don't disappoint me.
excuse me, I can't quite see the patient.
Doctor, have you reviewed all the test results recorded?
Oh, that's amazing. Are these the same guys? That's John A. What? Okay. Yeah. I got this one. So map. So this one is Phil. Okay. Yeah, I know. I'm amazing. What is this guy? Thomas. Can I call you Tom? Or you go by Thomas? Heaviness, a pain in my like a tight fist squeezing my heart in my chest while I was exercising. I was going to throw up for about 5 minutes. It went away when I rested. He was exercising. Well, let's give you the physical exam. That one sounds weird. Oh, wait, go back. Go back. I want to pick up this. Where's your heart at, sir? I'm not familiar where heart's at. Sounds amazing. You're doing real good there. Thank you, Thomas. Let's tap on your back. I don't know if I like that percussion. If you were a watermelon, I wouldn't buy you. Any weird stuff? Nope. Looks like we're gonna go do some lab work. Let's get out of here. Man. Let's go look at your blood. Oh, CBC, come on, baby. Lab work here. Let me check out your numbers. Well, your lab work is coming back pretty darn good. Do I need to get an x-ray? What did you complain about? Heaviness, pain, like a tight fist squeezing my heart in my chest. I was gonna throw up for about 5 minutes. Ugh. Let's go back to the library. Diseases causing chest pain.
Sometimes emotion can cause unusual reactions such as chest pain. Chest pain from anxiety reaction occurs during excitement or when upset.
Is running an excitement?
Pain can be similar to heart attack and can have all the similar signs.
Do I need to do a stress test on this guy? How do you know it's anxiety? I guess I need to do a stress test to
Unstable angina is also caused by narrowing of the coronary.
This one would cause enzymes, raised enzymes, right? What? Wait. EKG, normal or ECG? Tightness and squeezing. That's what he said.
The pain is similar to angina. The pain is squeezing in character or present as a recurring tightness in the chest.
What was the name of this one? I really need a co-pilot. Tightness and squeezing. Unstable angina. Normal. How do you do the ECG? Okay, I gotta look that up. 'Cause I'm not doing ECG. Because there's an echocardiogram. If it's not an echocardiogram, then what is it? Echocardiodiagram. is?
The physical examination.
Where's the ECG? It's like that's something else. Oh, there it is. ECG.
Electrocardiogram records the electric activity of the heart. The recorded activity is displayed as a tracing on a piece of paper.
Where do you do the electrocardiogram at?
This is a tracing of a normal heartbeat, recorded by different electrodes placed on the body. This is a P wave. This is QRS complex.
Electro and echo. Two different things. Oh my gosh.
This is ST segment. Notice that the ST segment is at the same level as the line from P wave to QRS complex. This is the T wave.
Okay. Thank you.
Angina may
That's the T
This
wave.
is the tracing that can be seen in angina or unstable angina. Here the ST segment is depressed and the T wave is inverted. Angina and unstable angina may sometimes show normal tracing. This is the tracing that can be seen in myocardial infarction. Notice that the ST segment is elevated and T wave is inverted.
Ew. I know all this stuff. I knew that. I gotta find where you get the ECG. I thought EKG. ECG? Where do you get the ECG done at? Stairs, human resources. In the emergency room?
There's not much going on in here, Doctor.
Okay. Critical care. Do you get it in the examination rooms? Stairs. Critical. Elevator. Operate. Stairs.
Doctor, have you reviewed all the test results you ordered?
No, I want to know. Where do I get the ECG? No, that's not the right room. Where do you do a freaking ECG at? Where do you order an ECG at? I don't see it anywhere. Chest X-ray, upper GI, stress test. It's not on here. Is this something that's supposed to be on here, but it's not? If that's the case, that's kind of annoying. Well, I haven't done any x-rays. So this is a squeezing. So it can be angina or no, unstable angina.
Angina is caused by narrowing of the coronary arteries that supply the heart.
Okay.
The heart does not receive enough oxygen and part of the heart muscle is injured. Tightness in the chest that lasts for a few minutes. Sometimes the pain can be squeezing in character. Pain is usually aggravated by excitement or exertion and improves after rest.
Oh, that's what he described. He might have an angina. ECG. I can't see an ECG. Echocardiogram. Stress test. I don't want to do catheterization. Elective coronary artery bypass surgery. It's an elective bypass.
Angina is caused by narrowing
Boom, boom. Oh my goodness, I missed it again.
unstable angina.
Is it stable angina or unstable angina? Now let's go back. Okay.
The pain is similar to angina. The pain is squeezing in character or present as a recurring tightness in the chest.
Okay. So, what's next? ECG. I can't do an ECG. Lab tests are normal. Echocardiogram. Stress test. Unstable angina. How do you know the difference? The angina clears up.
Angina is caused by narrowing of the coronary arteries that supply the heart. The heart does not receive enough oxygen and part of the heart muscle is injured.
Oh.
Patients usually complain of angina pain as tightness in the chest that lasts for a few minutes. Sometimes the pain can be squeezing in character. Pain is usually aggravated by excitement or exertion and improves after rest.
Yes, 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 yes. Come on, tell me more, tell me more. Heart sound, normal. Lung sound, normal. I think we're gonna do a cath on this guy. Let's cath this dude. Stress test. We can do a stress test and see what happens. And if that don't work, we're going to do the catheterization. Okay. Man. Let's do a stress test. Let's make this guy take the stairs. No, we'll go to the heart station. This is Thomas. Do I not have to put him through the stress test? Pretty sure you have angina, dude. How you feeling there, Thomas? How's your stress feeling? You stressed out? Okay, I'm gonna stop it. Don't die. Okay. Let's give this guy a catheter.
Dr. Black, report to the emergency room.
Doctor, you need to feel the femoral artery for the location.
Where's it at? It's right here. It's right here. There's the femoral artery.
The gauze, the guide wire, the scalpel, the xylocaine syringe.
Next, the scalpel.
Scalpel, please.
The scalpel.
You may want to soak the blood.
Let's
otherwise
get
it will be messy.
messy.
The gauze.
The next step, doctor, is to insert the needle.
Let's insert
The
the
needle.
needle. Whoa, he's got a needle.
Don't push the needle so deep.
Guys squirting blood on me. What's next?
The catheter.
You didn't say what to do next.
The viewer.
Let's look at the viewer.
Remember, xylocaine numbs.
Xylocaine. Check. Gauze. Check. Needle. Check.
Clot. If you miss it entirely, you could puncture a nerve, causing extreme pain for the patient.
Oh,
Or
good.
You may accidentally puncture a vein, which could cause internal bleeding. A little blood will appear. This is common. Next, insert the long guide wire through the needle and into the...
Which one was that? Okay, the guide wire.
Next, insert the long guide wire through the needle and into the femoral artery. The guide wire will be used to guide the catheter. Occasionally, you may encounter resistance from the guide wire. If that happens, simply pull the guide wire back and push it in again. If resistance is felt, do not continue to push. You could puncture the artery, causing internal bleeding. Remove the needle, leaving the guide wire behind.
Okay. Now we're
The guide wire.
putting the guide wire in.
Where is the introducer sheath, Doctor? Be sure you remove just the introducer and not the sheath.
The introducer sheath.
So, the introducer sheath's next. So this goes... Wait. Tell me about this interview. Blah, 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 blah. Why can't you pause it where I want it?
Automatically removed. The sheath is left behind to help guide the catheter into the artery. Insert the catheter over the guide wire and through the sheath. Push the guide wire catheter combination into the descending aorta. It is important to check the position of the catheter.
What?
The catheter over the guide wire and through the sheath. Push the guide wire catheter combination into the descending aorta. It is important to check the position of the catheter over the guide wire and through the sheath. Push the guide wire catheter combination.
Okay.
The introducer sheath.
Let's do that then.
Pick up the catheter and introduce it over the guide wire. Don't forget to check its position with fluoroscopy, and don't forget to pull the guide wire.
Whoops.
The catheter.
Oh, no.
Doctor, the manifold has 3 holes. One is for pressure, one to flush the catheter, and one to inject the dye. Make sure you select the right valve or you will be in trouble.
Oh, no. I don't
Guide wire.
think I did that right. I don't think I did that right. Can I put it back in there? Ah, I've gone too far. I've gone too far. That's not good.
The gauze.
That's not good at all. Oh, that's the catheter. Pull that back out.
The guide wire.
I want the guide wire back in there. That's not happening.
The catheter.
How do I adjust this thing?
The catheter.
I think I screwed it up. No, I don't want to pull it out. So that means it's at the base of his spine. Why is it pulling it out? I want to go this way. Do I hold it down? I don't understand. I think this gets in a weird state where it doesn't work correctly.
The guide wire. The manifold. The guide wire. The catheter. The guide wire. The gauze.
Because this is stuck now.
The guide wire.
So the guide wire needs to go in, actually.
The catheter.
Is there a way to restart
The
this?
catheter.
It's screwed up. I'm sure this feels great to the patient. Go in and out. What does this look like? Has it moved? That's the catheter. It's not letting me do the things I'm supposed to do.
The guide wire.
Guide wire is supposed to go in there before. Oh, this is just
The gauze.
great. Oh, I can clean that up.
The xylocaine syringe. The guide wire.
Here. Pull that out.
The guide wire.
Can I pull anything here?
The xylocaine.
Nope.
The catheter.
Xylocaine for me, please.
The xylocaine syringe. The manifold.
Nope. No manifold.
The catheter. The guide wire.
The guide wire didn't work right. I clicked something too fast and it screwed up. It's not very forgiving.
The manifold.
Oh well, let's get out of here. Maybe he'll tell me what the test did.
Great work, Doctor.
Oh, thanks. Let's see what that test came up with. The cath. Cardiac cath results. Nothing. Normal. Oh, I didn't do that. I didn't do any x-rays. Yikes. Thomas. Chest x-ray. Normal. What does angina? What does it do?
Angina is caused by narrowing of the coronary arteries that supply the heart.
Okay. What does that test show? Hey, man. There's do-overs and surgery all the time. I just want to get to the heart surgery part. Freaking creeps me out. Wait. Normal, not necessary. Okay, so I can do an echocardiogram without getting bitched out. This is Thomas. I mean, yep, looks good to me. I think you should get a second opinion. He's pregnant. There's an alien baby in Thomas. Let's see. Treatment. Breathe into a paper bag. Let's see. X-rays. What does it say? Normal, normal, normal. I gotta get this catheter in here. You can send him to a psychiatric consultation. Breathe into a paper bag. Psychiatric consultation. Order the above treatment. I don't think this has a like a chaplain in it. It'd be nice if it did. Let's see if I can redo this catheter. It's this place. I know who it is.
It's about time you got here, doctor. The patient has been prepped and he's ready for catheterization.
Oh, I still have the... He's ready to be cathed.
Doctor, you need to feel the femoral artery for the location.
The artery is right here. This ain't my first rodeo. This is just the padding process. This is, you gotta tenderize the area.
The gauze. The scalpel.
Make a little incision right here.
You must inject xylocaine first.
Oh, I skipped the set. I skipped this.
The xylocaine
I
syringe.
screwed up. I already screwed up.
Next, the scalpel.
There.
The xylocaine syringe.
I already did that.
Scalpel.
You may want to soak the blood, otherwise it will be messy.
Messy. I love how he says messy.
The manifold. The gauze.
Pat.
The next step, doctor, is to insert the needle.
The viewer.
Here, wait. I want to do this part right.
Remember to put scalpel, you
Okay, I know how to do the gauze. Okay, tell me the needle part.
Now, you insert the needle through the incision. Be very careful how and where you insert it. If you push too deep, you could penetrate through both walls of the artery, which may cause a blood clot. If you miss it entirely, you could puncture a nerve, causing extreme pain for the patient. Or you may accidentally puncture a vein, which could cause internal bleeding. A little blood will appear. This is common.
Okay.
The needle.
Wish me luck.
Don't push the needle so deep.
I didn't barely push it deep at all. Let's clean it.
The gauze. The catheter.
I know this is
Introducer sheath.
supposed to go in next. Why is this not working? Did I do it wrong again?
The viewer.
Did I do it wrong again?
Remember to put the lead gap.
There's the scalpel.
Incision. Be very careful how and where you insert it. If you This is common.
Did I not get it in deep enough? Okay.
Next, insert the long guide wire through the needle and into the femoral artery.
Guide wire
The guide
goes
wire
next.
will be used to guide the catheter. Occasionally, you may encounter resistance from the guide wire. If that happens, simply pull the guide wire back and push it in again. If resistance is felt, do not continue to push. You could puncture the artery, causing internal bleeding. Remove the needle, leaving the guide wire behind.
The guide wire.
Okay, we're going in with the guide wire.
Where is the introducer sheath, Doctor? Be sure you remove just the introducer and not the sheath.
The catheter.
Can I push the guide wire in front? No!
Doctor, the manifold has 3 holes. One
It's
is for
screwed up
pressure,
again.
One to flush the catheter, and one to inject the dye. Make sure you.
Oh my
select the right
gosh.
Great work, Doctor.
Shh. No, it wasn't. It wasn't great work. Did I get the results of this? No. Okay, I'm going to cath the crap out of this guy.
It's about time you got here, Doctor. The patient has been prepped and he's ready for catheterization.
Yes.
Doctor, you need to feel the femoral artery for the location.
It's right there, baby.
The xylocaine syringe.
Next, the
Xylocaine.
scalpel. Next, the
Give him
scalpel.
more xylocaine.
Next, the scalpel.
This is like very unforgiving. I thought heart surgery would be better than this. Or easier.
The scalpel.
You may want to soak the blood, otherwise it will be messy.
The gauze.
We don't want it to be messy.
The next step, Doctor, is to insert the needle.
The needle.
Don't push the needle so deep.
Okay, you gonna tell me what to do next?
The view. The guide wire.
Okay, the guide wire goes
The
in.
guide wire. The gauze. The view. The gauze. The catheter. The guide wire.
Okay, I know the guide wire goes in next.
Ventricle now. Your ventriculogram. Stay right where you are. I need to pull this.
Where is the introducer sheath, Doctor? Be sure you remove just the introducer and not the sheath.
The introducer sheath.
Introducer sheath. Okay, let's go in, man.
Ventricle now. Your ventriculogram. Stay right where you are.
There it comes out.
Pick up the catheter and introduce it over the guide wire. Don't forget to check its position with fluoroscopy, and don't forget to pull the guide wire.
So, okay.
Ventricle now. Your ventriculogram. The catheter.
You put the catheter in there now, then you pull the guide wire? What does this look like? Can I look at it? Okay, it's in there. Okay. I got that part. The guide wire's in
The
there.
viewer.
Remember to put the
I wonder if doctors really have quick viewers like this. I mean, you just have tablets now, but this was the 90s. That's the guide wire. Pull the needle. Inserter.
wire and through the sheath. Push the guide wire catheter combination into the descending aorta. It is important to check the position of the catheter. You should use the fluoroscopy monitor, which must be turned on when needed, to check the position of the catheter. X-rays passing through the patient allow you to see the catheter's position on the monitor. In order to activate the fluoroscopy monitor, push the play button. Once you have analyzed the image, press the stop button. Once you're sure it's in the aorta, pull the guide wire out.
Hoof, are you like taking notes? Okay, you pull the guide wire out after it's in the aorta. Aorta? Aorta?
The catheter.
Okay, we're going in with the catheter.
Ventricle now. Your ventriculogram.
Let's look at it.
Stay right where you are. I need to pull this thing around. No, I can get it here.
Oh, you gotta help me out with this. Okay, so it looks like it's in the spine. Is this the pelvic region? Okay. How do I make sure not... There we go. There we go. Let's take a look at this baby. Looks like we need to go further. It's the chest. What does this look like? I don't know. I need your wife's help. That's as far as it goes in. Does this look normal? Can I pull the guide wire out now?
Ventricle now. Your ventriculogram.
I mean...
Ventricle now. Your ventriculogram.
Doctor, the manifold has 3 holes. One is for pressure.
The guide wire. The manifold.
Well, I know the manifold goes on next. Let's hook it up, baby.
Doc, make sure you remove the air bubbles from the catheter in the manifold, or you will blow bubbles in. That's a no-no.
But bubbles are awesome. Let's see. How do you get rid of bubbles? Why wouldn't you want to blow bubbles into the patient? Yep. I know all this stuff.
On when needed to check the position of the catheter. X-rays passing through the patient allow you to see the catheter's position on the monitor.
Totally, that's what mine looks like.
In order to activate the fluoroscopy monitor, push the play button. Once you have analyzed the image, press the stop button. Once you're sure it's in the aorta, pull the guide wire out.
I have no idea if it's in the aorta or not.
Next, attach the manifold to the end of the catheter. Initially, all valves on the manifold should remain closed.
Okay.
Gradually, you need to advance the catheter up the aorta to the coronary. You'll be checking its progression on the right monitor. Now attach an empty syringe to the end of the manifold.
Yes.
Open the dye valve. The dye is automatically drawn into the syringe. Inject the dye into the coronary artery. Check the fluoroscopy monitor to make sure that the catheter is positioned in the coronary artery. You will see the dye darken the artery. If the heart rate waves change to smaller waves, the catheter is directly against the coronary artery wall. You will need to reposition the catheter. If you need to reposition the catheter, you have to inject more dye into the artery to see its location each time.
Okay.
The catheter is now in the left ventricle, and you will see the ventricle pumping.
Yep.
Note the pressure of it on the left monitor. If the patient has aortic stenosis, the pressure wave will not fall as steep. Eventually, you will see either one of two things: the normal artery and its branches, or you will see a blockage in the coronary artery or one of its branches.
Oh, right.
If necessary, you can replay the movie by pushing the rewind button.
Well, let's just,
The guide wire.
let's just do this thing. Nope, no, not to die. Can't you adjust this thing? Ah, there we go. I think that's what it's supposed to look like. So
The empty syringes.
put the syringe in here. Open the dye up. Whoop whoop. I don't think that was right.
The empty syringes.
So you put the syringe on. They opened the... Could have had a part 4 of this. Yeah, no wonder he's like losing weight. Oh, this takes so long to get to the end of this. Give me the manifold. Okay.
Now attach an empty syringe to the end of the manifold.
Do the syringe. Step 1. What's on
Open the
there?
dye valve.
Open the dye
is
valve.
automatically drawn into the syringe. Inject the dye into the coronary artery. Check the fluoroscopy monitor to make sure that the catheter is positioned in the coronary artery. You will see the dye darken the artery. If the heart rate waves change to smaller waves, the catheter is directly against the coronary artery wall. You will need to reposition the catheter. If you need to reposition the catheter, you have to inject more dye into the artery to see its location each time.
Okay. So it's in there. So if these turn to small waves, it's not positioned right. Okay, I think we're good.
The viewer. The xylocaine syringe.
Are
The
we
viewer.
good? Did we do it? Oh my gosh, I gotta watch this again. I want to get to the heart surgery part. It's crazy. Yeah, that looks right.
The dye is automatically drawn into the syringe. Inject the dye into the coronary artery.
No, just heart catheters.
Check the fluoroscopy monitor to make sure that the catheter is positioned in the coronary artery. You will see the
I wonder
dye
if there's
in the
a
artery.
virtual
Heart rate waves change to smaller waves. The
virtual
catheter is
vasectomy
directly against the coronary artery wall. You will need to reposition the
DOS
catheter.
name.
If you need to reposition the catheter, you have to inject more dye into the artery to see its location each time. The catheter is now in the left ventricle, and you will see the ventricle pumping. Note the pressure of it on the left monitor. If the patient has aortic stenosis, the pressure wave will not fall as steep. Eventually, you will see either one of two things: the normal artery and its branches, or you will see a blockage in the coronary artery or one of its branches. If necessary, you can replay the movie by pushing the rewind button.
I'm not sure what I'm
Remove
seeing.
the syringe. Now, disconnect the manifold.
There's no left hand in this.
The xylocaine syringe.
Just jam that baby in there.
The empty syringes.
Show me the stuff. There we go. We got it. Ladies and gentlemen, we got him. Replay it. Do we got a blockage? We might get to do the heart surgery. Okay. Turn this off. Oh no. It freaked out again. Ah,
You can
crap.
leave now, Doctor. I'll close up for you.
Oh, fine.
Maintenance, call 5134.
It kicked me out. Let's see how you doing, Tom. He has a coronary artery blockage. He has a blockage. So, what does that mean? That means is it angina?
Angina is caused by narrowing of the coronary arteries that...
So it's just regular angina, I think. You're an angina. Did it say anything about the catheter? No, it's over here. Blockage of the artery. You have angina, my dude. Elective coronary bypass surgery. So, let give you some treatment, buddy. Diagnosis. I'm going to diagnose you with angina and give you psychiatric consultation. Diagnosis. Okay, we did that. Stable angina. Treatment. Elective bypass surgery. I feel good about this one. Oop. I'm glad I put this music over. It makes this game so much better. Good atmosphere. Well, let's see how we did. Did we do it? Treatment. Order the above. Do we have surgery now?
I thought you were needed in surgery.
Oh, we're gonna do the elective bypass surgery. Ooh. Totally scared. These surgeries freak me out. Let's see. I'm gonna take the stairs. Can I?
Excuse me, doctor. I need your signature on this. Thanks.
Thank you. I want to go. I'm taking the stairs. Because I care about my health.
Maintenance, call 5134.
Keep up the excellent work, Doctor.
Excuse me, I can't quite...
I'm a professional here. These surgeries do freak me out. I don't see you doing fake surgeries. I do fake surgeries all the time. You can tell this is the 90s where you only have to have face masks when you're going to do surgery. Putting my face mask on. Now the trick with this one It's like, oh, you want to go for the soap first? But no, 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 no. You turn the water on first. Then you soap up. I love this animation so much. And then you don't turn the water off, you just walk in. Okay. My hands are already sweaty. I'll have to wash my hands again.
First, select the headlights.
Oh man, this beeping's loud. Beeping is gonna have to go down just a scooch. Well, I need the headlamps.
The headlight must be worn at all times or else visibility will be too poor to operate. Select the scalpel and make the skin incision.
Ugh.
The large scalpel is used during the following steps.
You can't tell me this crap ain't crazy. Check this out.
Use the cauterizer to cut the fat twice.
Oh, the cauterizer. Which one's the cauterizer? It's this one.
The electrocauterizer is used to separate the fat from the sternum after the initial incision and to cut the pericardium to expose the heart.
I don't want to do it. I don't want to do it. Is that it? Are we good?
Now turn off the anesthesia machine.
Turn the anesthesia machine off. Oh yeah. If you don't do this, you'll cut their lungs open. I gotta turn out the knockout machine.
Use the reciprocal saw to cut the sternum.
Okay, it's gonna start getting to the
cut the sternum from bottom to top.
bottom to top. This one's gonna start getting freaky.
You were taking too much time to cut the sternum.
Oh, was I? Excuse me. Is it done?
Use
I don't want to.
cauterizer to cut the pericardium.
What's the pericardium? It's beating. It's beating. I don't want to do it anymore. Let's cut the pericardium.
Use the non-absorbable sutures to open and secure the pericardium.
You must turn on the anesthesia machine first.
Oh, we gotta turn the anesthesia machine back on. Whew. They said the non-absorbing, right? I think that's what it said. It's this one?
The absorbable sutures. The non-absorbable sutures are used to sew the pericardium to the chest wall.
Okay, let's do it.
Use the absorbable sutures to apply purse string sutures at the top, middle, and lower parts of the heart. Stitch 6 times at each site.
Oh, should look at this thing. They like put a video of a real heart beating in there. It's not cool. Absorbable.
The absorbable sutures are used for the following steps, depending on the operation. Sewing the 3 purse string sutures, attaching the saphenous vein, attaching the artificial valve to the heart, closing the aorta, and lastly to close the chest once the operation is complete.
This literally makes my hands start sweating. It's freaks me out so much. This is like worse than playing a horror game for me. Oh, don't want to do it. And where's the other one?
Administer heparin.
Minister heparin.
The syringe containing protamine is used. Heparin is injected after the insertion of the purse string sutures to prevent blood from clotting.
Do that for me, nurse.
Doctor, the heparin has been administered. Use the scalpel to make an incision in the center of each purse string suture.
Ooh.
The large scalpel is used during the following steps: to make the initial incision in the chest, to make the incision inside the purse string sutures, and to make the cut in the aorta which exposes the heart valve in bypass surgery.
Okay, we're gonna do it. Make the incisions in this heart. 1, 2.
Insert the arterial cannula in the upper purse string.
Arterial cranula. Which one's that?
The pacemaker wire is used.
Nope.
The arterial cannula is inserted
Cannula.
first into the aorta.
Okay, let's insert this into the aorta.
You must insert the cannula into the hole. You must insert the cannula into the hole.
Tell this guy to stop moving.
Click on the aortic cannula 3 times.
3. 1, 2, 3. I am clicking on it. I don't understand this part. It says click on it 3 times. With what? Ah. I'm clicking on it. I wonder if this is something to do with the CPU's going too fast, so it doesn't register my clicks, right?
Click on the clamp.
There we go. There we go.
The arterial tubing to the arterial cannula.
Arterial tubing. Arterial tubing.
The arterial tubing is used to attach the arterial cannula to the heart-lung machine.
I love how he grabs that.
No, you're clicking in the wrong location. The yellow banded tube goes on the lower cannula. The clear tube goes to the upper one. No, you're clicking in the wrong location. No.
What?
Clicking in the wrong location. No, you're clicking in the wrong location. The yellow banded tube goes.
Okay.
This portion of the tubing is attached to the venous cannula, allowing the heart-lung machine to circulate the blood once the heart stops.
No, you're clicking in the wrong location. No, you're clicking in the wrong location. No, you're clicking in the wrong location. No, you're clicking in the wrong location.
Where's this tube go?
No, you're clicking in the wrong location.
It doesn't go here.
You're clicking in the wrong location.
Oh my gosh.
The venous
I swore it said to use this one.
No, you're clicking in the wrong location. No, you're clicking in the wrong location. The yellow banded tube goes on the lower cannula. The clear tube goes to the upper one. No, you're clicking in the wrong location. No, you're clicking in the wrong location.
No, I'm clicking in the wrong location. Okay, let's refer to our little. Oh wow, is this bypass? This is bypass surgery. Aorta, cardiac, let's check. Blah, 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 blah. We're just doing the preparation. No, this is not what I need to see. I mean, everything's done by that. Everybody has access to all knowledge just through preparation. This is what we need to do.
All surgical procedures for heart disease.
Bling, bling, blam, blam. Crank that baby open. Get me to the right spot here. Okay, that's where we're at.
The arterial tubing to attach the cannula to the heart-lung machine.
It was the clear one.
Click on the arterial cannula and it will be connected.
What? Where did you do that at? It went
Click on the arterial cannula
all the
and it will
way
be connected.
up. I don't even see where that went, dude. Where are you going now, man?
Use the scalpel to make an incision in the atrium inside the purse string suture. It is important that the arterial cannulation is done before venous cannulation. Select the venous cannula and insert it into the atrium.
Okay. Let's get this
arterial
tube.
No, you're clicking in the wrong location.
Oh, am I?
No.
Oh,
you're clicking in the
goodness.
wrong location. No, you're clicking in the wrong location. No.
I
you're
swore
clicking in the
his
wrong location.
thing was up here.
No, you're clicking in the wrong location. No, you're clicking in the wrong location.
You're
No,
killing me,
you're
man.
clicking in the wrong location.
This... Does it go up here? No, that takes me out.
No, you're clicking in the wrong location.
Does it go...
No, you're clicking in the wrong location. The yellow banded tube goes on. No, you're clicking in the wrong location. No, you're clicking in the wrong location.
A thin tube inserted into the vein or body cavity. Yeah, but is it... It said like to put it... Which one's which? It's like no matter where I click, it's not the right one.
You're clicking in the wrong location.
Well, there's the cannula. This is the cannula. It's like the tube's supposed to go in it, but it doesn't go.
In the wrong location.
Insert the
Oh.
venous cannula into the
Jeez,
lower
I clicked
purse string
there.
suture.
Oh my gosh. It was right there. It was this one. What'd she tell me to do? Okay, now I lost my spot because I was exasperated. Crap.
Almost all surgical procedures.
Come on, let's watch more YouTube. This stuff's intense. Yeah, I think we gotta make a cut or something, though. I lost the storyline.
The cannula too deep, as this could tear the aorta. However, if the cannula is not deep enough, it will come out.
Can we make this a speedrun game?
Remove the clamp from the aortic cannula and
This would be a fun speedrun game.
This will ensure that there is no air in the cannula and that free flow is... Select the arterial tubing to attach the cannula to the heart-lung machine.
I guess you gotta see where the end of the tube goes on here.
Click on the arterial cannula and it will be connected.
That doesn't show you where it goes.
Use the scalpel to make an incision in the atrium inside the purse string suture. It is important that the arterial cannulation is done before venous cannulation.
I cut it beforehand. Is that a problem?
Select the venous cannula and insert it into the atrium.
Venous cannula. Then the yellow tube.
To attach it to the tube that connects to the heart-lung machine.
Okay. Let's get the scalpel.
You must do the arterial cannulation before the venous cannulation. No, make the cut inside the purse string ring.
It's already...
You must do the arterial
okay. It's already cut. It let me cut it beforehand and not kill this person. Only sliced his heart open.
The venous cannula is inserted second into the atrium.
Well, you're going into the atrium. Doctor. Which...
Click on the venous cannula until the purse string is snug.
Venous cannula.
Apply the venous tubing to the venous cannula.
Venous tubing. Oh, the tubing goes up here. Is this like cut off or something? Okay. Tubing.
A portion of the tubing is attached to the venous cannula, allowing the heart-lung machine to circulate the blood once the heart stops.
Yeah. Put a twist tie on there.
Insert the cardioplegic cannula in the middle opening.
Cardioplegic cannula? Is that what it said?
The cardioplegic cannula is inserted last into the aorta just beneath the arterial cannula.
Okay. So that goes... See?
Click on the cardioplegic cannula until it is capped with tubing. Turn on the heart-lung machine and turn off the anesthesia machine.
What? Which one? No, this is the... Oh, crap. I think I did that in the wrong order. Go up there. Is that right? Is this the heart-lung machine? This is the anesthesia machine. Does this say turn on the heart-lung machine? Do you remember? I don't remember. I'm panicking, man. Oh, this is freaking me out. Okay, anesthesia's off. And this needs to be on.
Apply the clamp between the arterial cannula and the cardioplegic cannula.
Oh, which one's that? I need a clamp.
The curved arterial scissors are used to cut away.
That's scissors.
The aortic clamp is applied.
That's the aortic clamp.
The small scissors are used.
Okay.
The aortic clamp is applied between the arterial and cardioplegic cannulas.
Do I cut the red wire or the red wire? Which one does it go to? Oh, hang on. My music's screwed up. I don't want to do this one. The other one's copyright free. Go back. Thank you. Which one's which?
No, you're clicking in the wrong location.
This is not the right instrument.
Okay.
The drainage tube is attached immediately after the pacemaker.
Where's the clamp?
The curved arterial.
Those are scissors.
The aortic clamp is applied between the arterial and cardioplegic cannulas.
No, you're clicking in the wrong location.
This is not the right instrument.
No, you're clicking in the wrong location.
This is not the right instrument.
Colored ones. Colored clamps?
Pacemaker wire is utilized before the. The small scissors are used to cut the saphenous vein. The non-absorbable sutures are used.
Those are sutures.
The absorbable sutures. The metallic sutures are used to sew up the sternum. The aortic clamp.
This is the only thing that's a clamp.
The small.
Okay, back to YouTube.
Almost.
And this is just the prep. This isn't even the heart surgery. That's definitely a heart. Okay, we're about here. Goes to this one. Put the garden hose in there. And put the yellow garden hose. Yellow garden hose goes to this.
Arterial and venous cannulation inside the third purse string suture. Insert the cardioplegic cannula.
Okay, that's a cardioplegic cannula.
Begin the cardiopulmonary bypass.
Okay, we turned that on.
Also stop the anesthesia machine.
We turned that off. Okay, we did that. This is where we're at. That's the clamp.
Apply the aortic clamp between the cardioplegic cannula and the aortic cannula. Topical cardiac cooling begins by pouring ice-cold saline into the chest.
Then we pour.
At the time, the cardioplegic solution is also administered. The cold cardioplegic solution contains high amounts of potassium, which paralyzes the heart.
Oh, that's so creepy.
Stops beating, and the patient is now supported by the heart-lung machine, which circulates the blood.
Oh, this is so messed up. I don't want to do it. I don't want to do it.
Select the binoculars to get a closer view of the coronary vessel. In the actual surgery, the cardiac surgeon wears the headlight and binoculars from the start. In the game, you select the binoculars.
Just put the bunch of water on there. Okay. So at least that's the end of the preparation. And this is the right clamp. It goes right here.
Pour the cold saline over the heart.
I don't wanna.
Ice cold saline to stop the heart. Cleanse all cannulas in the aortic.
Oh, that's so disgusting.
Select the binoculars.
I gotta select the binoculars.
Use the small scalpel to make an incision in the blood vessel below the blockage.
Oh,
Maker wire is utilized before the cannulas are removed.
I need the small scapula.
The small scalpel is used to make a tiny
Scapula?
incision
Scalpel.
in the coronary artery beneath the damaged area.
Oh, this is gonna be an S rank. Oh, oh, no, no, nope, nope, nope. That's a nope. That's a nope. We're gonna have to watch YouTube for this one.
Coronary artery bypass grafting attempts to reestablish the blood supply to the heart. A connection is created between the aorta and
That makes me creeped out.
saphenous vein is moved to the tool table just
Okay.
below the
Where we're cutting here.
coronary artery just below the clogged segment.
Don't want to cut it. I don't want to cut it.
Select the curved scissors.
I just want it to be over.
Several cuts
Then we do a snip, a cut, then a snip. My hands are so sweaty.
Select the saphenous vein in the bowl. Release it over the operating field by clicking once. A ruler will appear.
Oh, there's gonna be a map.
Select the small scissors to trim the vein to the desired length. If the vein is too short, it will be stretched once the heart starts beating. If it is too long, it may kink.
How do I? Is that the scale even?
Absorbable suture to attach the vein. Click on the incision site to secure the vein to the artery.
Oh, don't.
If you make an error, you can remove the sutures and try again if you click on them with the open hand.
Okay, let's just do a little.
Small
It was like right here.
Use the curved scissors to widen the incision until it is wide enough.
Let's get some scissors.
The small scissors are used to cut the saphenous vein to the proper length, or to cut the excess suture.
No,
The curved arterial scissors are used to cut away the diseased leaflets in the human heart valve.
what?
Or to lengthen the incision made by the small scalpel in the coronary artery in bypass surgery.
Okay, that's what we're doing. I don't want to.
No, make the cut on the incision.
Select the saphenous vein and click it on the heart.
Okay, let's get the saphenous vein. It's the specimen.
Saphenous vein is used to connect the coronary artery to the aorta so that blood
It's tape work.
Select the regular scissors and cut the saphenous vein to 6 inches.
Okay. I can do that. I can do that.
The small scissors are used to cut the saphenous vein to the proper.
I can cut 6 inches. 6 inches. 6 inches.
Select the absorbable suture and apply it to the saphenous vein.
Okay. Absorbable sutures.
The non-absorbable. The absorbable sutures are used for the following steps, depending on the operation. Sewing the
Apply the end of the saphenous vein to the incision. Go to the tool table, return to the patient, and remove the cardioplegic catheter.
What? What did it tell me to do? It told me to remove the cardioplegical catheter?
The defibrillating.
Is that it? Is that the Is that the thing we're supposed to move?
Use the hole puncher on the cardioplegic opening.
There's already a hole there. I don't think we need another one.
The hole punch is used to widen the cut left by the cardioplegic cannula once it is removed, so that the saphenous vein can be attached.
Oh, okay. So gross.
Apply the absorbable suture to the saphenous vein.
Okay. Yes, nurse.
The non-absorbable.
Okay.
The absorbable suture.
Apply the end of the saphenous vein to the hole.
Sure.
Click on
Just-
the binocular silhouette to remove them.
It's got bypassed.
Remove the clamp.
Wait.
The defibrillating paddles are used. The pacemaker wire is utilized.
Remove the clamp.
If the heart fibrillates, apply the defibrillator paddles.
How do I...
Clipping tool to stop all the bleeders.
What?
The staple.
What do I do?
Apply the pacemaker. Apply the pacemaker.
Oh, I'm just glad I knew that was the stapler.
The pacemaker wire is utilized before the cannulas are removed to prevent life-threatening irregular heartbeats.
Okay. Does anybody know where the pacemaker goes?
Apply the drain.
The drain. Where do you apply the drain to?
The drainage tube is attached immediately after the pacemaker wire so that fluid can drain from the heart.
Where?
Start the anesthesia machine and stop the heart-lung machine.
Okay. Is it defibrillating? I think it's defibrillating. No! Go up. Turn this off. And go. Turn this off.
Remove the venous cannula.
Which one's the venous cannula? Is it defibrillating?
The defibrillating.
It's defibrillating. Hey, look, it worked. All you do is have to shock it a little bit. Okay, which one do I remove? This one?
Click on the arterial purse string sutures.
Arterial purse string sutures?
The metallic sutures are used to sew up the sternum. The absorbable sutures are used for the following steps, depending on the operation. Sewing the 3 purse string sutures, attaching the saphenous vein, attaching the
Okay.
artificial valve.
It's this one.
This is not the right instrument.
Oh, he's defibrillating again. Shock that heart. What did it say to do?
Heparin is injected after the
Oh my gosh, I'm about to watch YouTube.
Coronary artery.
Let's watch YouTube. Let's get this right. I don't want to do this again. Oh my gosh, that worm's so disgusting. Oh, is that it? What's the next steps? Is this the...
Aortic valve replacement.
Oh, that's disgusting. I saved some lives. This guy might die, though. How do you close the chest?
Coronary bypass surgery or aortic valve replacement has been completed. You need to close the patient's chest. First, remove the aortic clamp from the aorta by clicking once.
Okay, we did that. Shock the heart. Kickstart start. Put that on. Did that.
Valve replacement.
What?
To restart the anesthesia machine as the patient's heart starts to beat. Remove the venous cannula by clicking once. Tie the purse strings and prevent more bleeding by clicking again. Remove the arterial cannula and tie its purse strings the same way. If you have performed valve replacement, the cardioplegic cannula will also need to be removed and its purse strings tied.
What?
Click on the
Okay.
Apply Protomine.
What?
Click on the venous purse string sutures. Remove the arterial cannula.
What's the arterial cannula?
You must administer protamine first.
Gotta administer protamine.
Heparin is injected. The syringe containing protamine is used once the cannulas are removed to counteract the effects of heparin.
Okay.
On the pericardium.
What's the pericardium?
Heparin is injected after the insertion of the purse strings.
Click on the sternal retractor. Use the metal sutures to apply 5 sutures.
Oh, the metal sutures.
The metallic sutures are used to sew up the sternum.
5 sutures. 1, 2, 3, 4,
Use
5.
the absorbable sutures to close the skin.
Absorbable sutures.
The absorbable sutures.
Okay, it's those. Are we done? What now?
Heparin is injected after the insertion of.
What do we do now? Do we win? Is he dead? Did I leave something in there?
After the coronary.
Oh my gosh. Yeah, I don't know. Okay, there's that. That's up. Did that. Did that. Okay. Is he... Are we done? Do I give him a kiss on the forehead? I think I'm done. I wonder if I can open him back up. Let's open him back up and just give him another shock to the heart. Let's see. Oh, the thing's not there anymore.
The large scalpel is used.
This is not the right instrument.
What instrument do I need? Do I need to...
This is not the right instrument. This is not the right instrument.
Is he good now?
The stapler is used to close.
I don't need a stapler. Did we do it? Doesn't say anything.
The stapler.
It doesn't say anything about
After the coronary bypass surgery or aortic
about bedside manners here. Shocked the heart. Kick-started the heart. I removed all that stuff.
If you have performed valve replacement, the cardioplegic cannula will also need to be removed and its purse strings tied. Click on the protamine syringe to administer.
We did the protamine.
Protamine counters the effects of heparin, which as a blood thinner prevents clotting.
Oh.
Doctor, the protamine has been administered. Click on the pericardium to reposition it before closing the chest. Remove the retractor by clicking on it. Close the sternum with the metal sutures.
We did this.
Suture. If too few sutures are used, it will be loose. Too many will cause it to be.
Come on.
Finally, close the subcutaneous fat.
I want Thomas to live.
Absorbable sutures.
It doesn't say to do anything after this. Did I not? Did I not? Did I not suture him enough? Suture, 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 suture. Well, I think we've done all we can for him, boys. Time to get the heck out of here. Ugh. How'd it go, Doctor? Congratulations! Hey! We did it!
Congratulations, Doctor. You have successfully completed the fellowship training. You are now a full-fledged cardiac surgeon.
Did you hear that, boys? We're fully fledged. Dr. Papiopolis. I am now a doctor. I am now a professor.